Your patients love to be told what to do. They want clarity, they want specificity, they want you to show confidence. Sometimes I feel like they don't want freedom of choice, they want freedom from choice. And that's one of the things we're going to be talking about today on the Dental Practice Fixers podcast. I'm Dr. Richard Maddow, and I'm your host. And if you want to send me an email, you know how to find me. It's Rich, R-I-C-H, at Maddow, Madow.com. So I'm a big traveler. I love traveling. I've been to, I think, 65 countries, maybe a little more than 65 countries. I've been to every state in the US except North Dakota. So, hey, if you're running a dental meeting in North Dakota, contact me. Let's make a deal. I'd love to make it state number 50. But anyway, I also have seen many of these online surveys on different sites and apps and whatever, asking people who don't live in the US, they ask non-US people who have visited the US what they find really strange about our country. And I know we have many podcast listeners from all over the world. So maybe you're listening right now thinking, I know what I find strange about the US. Probably a lot of things. But three things that I find top just about every survey are number one, the huge size of our food portions. Wow, that explains a lot, maybe about the obesity epidemic in the US. Another thing that people find really weird is that most Americans wear shoes inside their homes. Now, I have several friends who, when you go there, they ask that you take your shoes off when you enter, which makes a lot of sense. I mean, we're outdoors tracking who knows what, germs and dog crap and slime and all kinds of gross stuff on the bottom of our shoes. It is kind of disgusting to wear shoes inside of our houses, but I do it. Probably most of us do it. It's so American, right? And a third thing that tops just about every survey is all the humongous amount of prescription drug commercials on TV. In most countries, they don't have this at all, but in the US, I mean, you cannot help but notice it seems like over half of the commercials are for some kind of prescription drug. So, hey, I know most of my American listeners know what I'm talking about. My non-American listeners, can you relate to all this? I'm guessing you can. Now, I'm not a huge TV watcher, but I do certainly tune in from time to time. And I also notice the pharmaceutical ads. They're unbelievable. And they seem to have a formula. There's like this crazy formula that all the pharmaceutical ads seem to take. First, it's like 20 seconds of people smiling and doing a lot of times some kind of physical activity, or maybe they're petting their dogs, which are usually golden retrievers or some kind of poodle schmoodle doodle mix. Maybe they're traveling, they're at a campfire with some friends making s'mores. You know, they're always doing things that seem to be fun activities. And then they talk about if you've got this symptom or illness or disease or whatever, ask your doctor about this drug, as if your doctor doesn't know enough to recommend it anyway. You've got to ask your doctor about it. And then the next 40 seconds of the 60-second commercials are discussing all the side effects, which are really scary. A lot of times they conflict, like, you know, this drug can cause diarrhea, it can also cause constipation. How can it possibly cause both? Then they go through all these side effects. And then the grand finale, which I love, they say is don't take Cosentyx if you're allergic to Cosentyx. It's like, what? Duh, are you kidding me? Like, if I'm allergic to something and I know I'm allergic to it, why would I take it? Don't eat lobster if you're allergic to lobster. Well, no kidding. No kidding. Don't take Ozempic. I love this. I just crack up every time I hear it. I think, is this real? And then, you know, of course, there's probably a team of lawyers that wrote this commercial saying we better tell them not to take Cosentyx if we're allergic to Cosentyx. But I think, like, are people really that clueless? And the answer is maybe they are. But here's the thing, other than legal ramifications and strategies and not being sued and all that stuff that, you know, of course, these pharma companies worry about, people love to be told what to do. They just love to be told what to do. And this is where dentistry comes in because our patients love to be told what to do. They love clarity and specificity and exactly knowing what's next or what they're supposed to do. And something else they absolutely crave is confidence from their doctor and from their team members. They want every time you suggest something or tell them what to do, they want you to do it with confidence. And This is why I'm a huge fan of, I'm going to review this whole list of things that I love to do in the dental practice. And all of these things show clarity, specificity, and confidence. For example, I am not a huge fan. I know sometimes it's necessary ethically, clinically, or whatever, but I'm not a huge fan of giving a million options when it comes to a patient's treatment. I just love telling them the best route, the thing that I would do on a family member or a close friend or someone of money or no object. Now, I'm not talking about being totally extravagant or over the top or over treating, but I'm talking about what ethically and functionally is the best treatment for that person. I love to look a patient straight in the eye and say, depending on the situation, some version of, I know what the problem is, and this is how we can fix it. It's just not a good look to be kind of mamby-pamby, or you're not really sure what to do. I mean, could you imagine if you had like some little growth on your arm and you're thinking, wow, is this a melanoma? What is this crazy thing? And you go to the dermatologist, and the dermatologist takes a look at it and he says, well, we could remove it, we could biopsy it, we could watch it. It's like, no, you don't want to know that. You want to be told what's the best thing for this situation, what is going to solve your problem. That's what you want to be told. You don't need all the other options. You want to know what's going to solve your problem. So I'm a big fan of not squirming around and apologizing and offering different things. Just look the patient in the eye. I know what the problem is, and this is how we can fix it. With a big smile on your face, the up and down yes shake to your head is always good. It just be confident that you're recommending something great for them. Okay, here's something else patients love, whether they know it or not, and that is explaining all the costs and the options of the different payment options clearly before treatment begins. No surprises, no squirming. There's nothing worse than, well, maybe there are some things worse, like getting a corkscrew put through your ear, but it's not good to have a patient commit to treatment without clearly knowing and completing the financial options. So every time there's money involved, it's not the most pleasant side of what we do, but the patient needs to know exactly what their costs are, whether it's a copay, a full pay, whatever, how this is going to be handled, and all that stuff arranged and signed off on before treatment begins. I always say, besides new patients, the number one no-shows are patients whose financial options weren't explained clearly, who don't understand their financial options. Something else patients love is being held by the hand, maybe metaphorically, but they don't like to be wandering around your office, not sure where to go. Say the dreaded wanderer. It's dreaded wanderer. We've all seen them and we've all been them. So, you don't want to say, okay, just go up to the front because they might not know where that is, or say, okay, it's great to see you, goodbye, and they don't know how to exit or find the restroom or do whatever. A patient needs to be accompanied by a team member every second they're in the office. Well, not if they're actually in the restroom, but you know what I mean. If they have to go up to the front desk, if they're trying to find their way out, let's get rid of the wanderer. Okay, something else. Got a whole list of them here. Oh, you know them. Um, when scheduling the next appointment, sometimes patients are kind of told this is the next appointment and they schedule, but they're not really clear exactly what's going to happen. So I say before that patient leaves appointment A and they're scheduled for appointment B, make sure at the end of appointment A, you tell them exactly what's going to happen in simple, non-scary language. So just to clarify, your next appointment, you're coming in for a core and crown. And we're doing this because, and of course, I'm just giving an example here. We're doing this because part of that tooth fractured and there's just not enough tooth left to successfully hold a filling. So what we're going to be doing is blah, 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 blah. Make sure they know exactly why they're coming in and what you will be doing. Makes the patient much more confident in the practice, much less likely to cancel or no show. They know exactly what's going to be going on. Along the same lines, tell a patient what to expect when the numbness wears off. I'd like to tell a patient, when the numbness wears off, you might feel a little bit of a soreness where we gave you the injection and the tooth might be a little sensitive, whatever it is. If you're not allergic to ibuprofen, we can even give you some now so that when the numbness wears off, you're a little bit more comfortable, but no surprises with anything. This is what to expect. Before doing treatment, when you were about to lean that chair back, say something like, hey, feel free to interrupt me at any time if you have a question or need a break or just want to be rinsed or anything, just give me a tap or a hand sign. Let me know. We can stop at any time to make you more comfortable. It lets them know that they are in control, and being in control is a great feeling for a dental patient. Now, when you're about to do the procedure, give them a little heads up for what they can experience, what they might feel, what they might be going through. You might be hearing the sounds, you might be feeling this. You should be completely not, whatever it is, let them know what to expect. And this goes everything I'm talking about, and we'll talk about the rest of this podcast. It's not just the doctor. We need to train our teams in the same confident, consistent language whenever you're doing answering the phone, discussing procedures, presenting fees, scheduling treatment. We all need to be on board with this aura of confidence, directness, being clear about everything, helping our patients understand exactly what they're about to do. I love using analogies. You know, when you're talking about perio treatment, before you do that beautiful cosmetic stuff, or before you do that crown, before you do the obvious thing like the broken teeth they have, an analogy like if we did that smile enhancement analogy, that crown now, that would be like building a house on a bunch of sand. It would just collapse. Your gums and the bone underneath your gums are the foundation for holding your teeth in. So if we don't treat that, then we could be doing all this other fantastic treatment, and you could wind up losing your teeth due to periodontal disease. So this is why we always treat this first. Or one that I kind of copied from my friend Dr. Nacho, Paul Goodman. Dental insurance is not like medical insurance. It's more like a coupon. I love that explanation. Everybody knows what a coupon is. It gives you a little bit of money off, but it doesn't pay for the whole thing. I love that explanation. Something else, following up post-treatment with a call, a text, or a video. So I just gave you a whole list of things any practice can do, costs no money at all, and will really help patients see things more clearly, be more confident in the practice and in the treatment they're about to get. It just makes for great patients, great referrals, all those good things we want. Let's be clear, and don't take Cosentyx if you're allergic to Cosentyx. Don't leave your patients wondering what the heck they're supposed to do next. Clarity, trust, all these things just make for a fantastic patient experience. So I'm gonna tell you right, I'm gonna do a quick plug here for a company that I love, and that's because it kind of all makes sense. If you want to know another place where all this clarity and communication really makes a huge difference, it's your website. I see so many just second and third rate dental websites, and the dentists have no idea. But most dental websites I see are confusing. They're outdated. They're missing essential information. They don't lead the patient to action, and they can actually drive patients away. Ouch! I actually speak to dentists who don't even have a website. This is unacceptable. And it's why I'm a huge fan of Simple Impact Media. They're an incredible company. They specialize in dental websites that are clean, modern, and make it easy for patients to go on the website and say, yes, I want you to be my dentist. And of course, along the same lines, they also do a great job with SEO, search engine optimization, because you can have the best website in the world, but if you don't have SEO, so when patients go on Google to find their new dentist, they're never going to see your beautiful website. Your website's fine for your existing patients, but let's face it, it's really powerful and a really good investment when it comes to somebody going online, Googling dentist near me or braces, Orlando, or whatever, and they come to your website. That's where SEO is the most powerful. So if you need a little website refresher, want to find out if you do, or want to get more Googling patients to find you, contact my friends at Simple Impact Media. Just go to madow.com/SEO. It's madow.com/SEO. You can schedule on the calendar of Evan Lazarus. He's the owner and founder of the firm. He's a great dude. He'll look at your website and your SEO. He'll give you a no charge analysis if he thinks you could use some improvement. And then if you're a Matto friend, you'll get a special deal like $1,000 off a new custom website, something different for SEO. So check it out, matto.com/SEO. All right. I hope you take today's message to heart. Clarity, directness, confidence. They're so, so, so important when it comes to treating our dental patients. So, hey, I am Dr. Richard Matto. Thanks so much for being a listener, a viewer, or whatever you are for the Dental Practice Fixers podcast. You can find me at Rich, that's RICH, at matto.com, and I'll talk to you soon. Thanks.